Hi everybody, and welcome to a short demonstration about IV insertion. So an intravenous device or an IV device, right, provides access to the venous system. And what we're talking about now is what we call a short peripheral intravenous device. In another video, we'll talk about central venous access devices. But here, we're talking about a peripheral IV. So we're talking about going into the veins of the hand, the veins of the arm. We never use the veins of the feet or the legs. So when we talk about these devices, these are basically inserted in patients. Every patient has one, right? They may have one just for what we call in case of emergency or just to have access in the patient. Other patients need them because they're going to be receiving IV fluids, IV medications, or maybe even blood products as well. So the types of catheters that we use for this insertion are generally referred to as over-the-needle catheters. And I think it'll become clearer to you when I show you some of the equipment. So when we're talking about inserting an IV, there are a number of things to keep in mind. First and foremost, this is an aseptic procedure. So it's not a sterile procedure in the sense that you need a sterile field or that you're wearing sterile gloves. But it is a procedure where a good portion of the equipment and pieces of the equipment need to remain sterile at all times. So when we're getting ready to insert an IV, first and foremost, we're going to, do hand hygiene. We're going to introduce ourselves to the patient. We're going to verify the patient's name and date of birth as two patient identifiers. We're going to be sure to check the provider's order because we do need an order to put in a peripheral IV because this is an invasive procedure. Only registered nurses and in some facilities, perhaps a licensed practical nurse, can do insertion of IVs. So let's take a look at some of the equipment that we're going to need. Now, most places will provide you with what is called the IV start kit. And again, just like all of our other kits, it comes with a little list of what is inside the kit. So what do we have here? We have a tourniquet, we have a roll of tape, we have a piece of gauze, we have an alcohol pad, and then we have a transparent dressing. The other thing, of course, that we're going to need is one of those over-the-needle catheters, or also known as an angiocath. The angiocaths come in different sizes, and correlating to those sizes are different colors. Perhaps you can see here there's a little bit of pink, and that signifies to me that this is a 20 gauge catheter. Another type of angiocath comes in this type of packaging, and the blue tells you right here that this is a 22 gauge. Don't get obsessed with memorizing the colors and the gauge numbers. Just know that IVs come in different gauge numbers. The gauge refers to the diameter of the needle. So one thing about these sizes when it comes to the actual numbers is that the higher the number, the actual smaller the diameter of the catheter. So it has like this inverse relationship. So in other words, a 22 catheter is actually smaller than a 20 gauge catheter. How do you determine what size catheter you want to use? Well, first and foremost, you have to see what kind of veins your patient has, right? Many of our patients have very small veins, veins that, are difficult to access. Other patients have some nice large veins that make it a lot easier to put in an IV, and you can use a bigger catheter. The other thing that we want to look at, of course, is what are we giving in this IV, right? Are we giving, constant IV infusion? Are we giving blood products? Blood, of course, is thicker than water, right? So we would need a bigger size catheter if we were going to give blood. If somebody's going to be getting continuous IV fluid and maybe continuous medications through that IV, we would also want a larger gauge. So, just keep those things in mind when you're trying to pick the site. The other thing about site selection is that we like to always start low and work our way up the arm. So if I were having an IV inserted, I would, the nurse that was putting it in would start in the veins in my hand and then move up my arm, both on the, upper posterior portion of the arm and then, of course, on the inside. So wherever they could find a vein is where they would want to start. So the reason for that is that if I put an IV to start with into this vein here, right? First of all, this place is a bad place for an IV because when your patient bends their arm, the IV stops, right? The other problem is that if this IV happens to infiltrate, so now you may say, well, what's infiltration? Infiltration means that whatever solution you're delivering to the patient has actually leaked out of the vein and into the surrounding tissue. Causes swelling, can cause tissue damage depending upon what kind of solution it is. And if that occurs here, then that means that everything below that insertion site is now off limits. I can't use it anymore because remember that all our circulation flows into each other. So again, we always want to start low and then move our way up. When a patient has an IV, we want to assess the IV site, right? So we want to take a look at the insertion site for things like redness or erythema, for swelling, for any leakage, any signs of infection, any red streaks going up the vein that could indicate something such as thrombophlebitis. There are a number of potential complications related to peripheral IVs that include things like hematoma formation, thrombophlebitis, as I just mentioned, just plain phlebitis, which is inflammation of the vein, that infiltration, and even something called an extravasation. And we'll go over these things, these concepts with you more in lab, and of course they are in your readings. So I'm first starting out with an assessment of my IV site. So this IV site actually looks good. The problem with this IV site is it's been in too long. Most facilities will have a policy that says that IVs need to be changed every 96 hours or 4 days. So in other words, we need to rotate these sites. So this IV has actually been in since June 1st, and so it's well overdue considering we're now in August, and this IV needs to be changed. So first I'll go over how to remove a peripheral IV. So of course, after performing hand hygiene, I'm just going to put on some regular clean gloves, and I'm going to start to loosen all of the tape that is around this IV. I want to be careful when I am loosening the tape because I don't want to accidentally pull out the IV while I'm just, simply loosening the tape, right? Because that can cause some unforeseen bleeding and discomfort to the patient, right? So I just want to kind of loosen all of this tape around. And then what I'm now going to do is I am going to, well, first let me get this tape off. Okay, so we have all of the tape is nice and loosened. The next thing that I'm going to do is I am going to use a piece of gauze. Let me just grab a piece of gauze here. Of course, I would have this all prepared before I'm doing it. I'm going to use a piece of gauze to cover the insertion site prior to pulling this IV out. So I have my piece of gauze. I'm going to go right over that insertion site. I'm going to apply some pressure, and I'm going to simply pull this IV straight back and out. Because this catheter no longer has a needle in it. You see it can bend, it's plastic. This can go directly in the garbage. This does not need to go in a sharps container. And then I'm going to have a, look at the site here. Let me just get off that extra tape. Make sure that there's no bleeding, and then I would put a Band-Aid in place. Okay, so now it's time for me to select a new vein to put in my new IV. So I'm going to actually take off my clean gloves, and I am going to do a little hand hygiene, and then I'm going to do a little assessment for the actual site. So I'm going to again introduce myself, explain to the patient the procedure that we're going to do, make sure that I identify them with the 2 patient identifiers, name and date of birth, and now I'm going to start looking to see where I think I might see a good vein. So I actually, well, maybe I'll use this side since that shows on the video a little bit. Well, maybe not. There actually is a good vein right here, okay, so I think I'm going to select this vein. So I really want to make sure that this vein is going to, provide the access that I need. So I'm going to open up my IV start kit, and I'm going to put the tourniquet on the patient's arm. Okay, so again, like all our other packaging, the package peels open, okay? And inside here, again, this is not a sterile procedure, so I can touch everything that's in here. So let's have a look. First of all, we have a small, transparent, occlusive dressing. I have an alcohol swab. I have a small piece of gauze, a 2x2. I have a roll of tape for additional securement, and then I have a tourniquet. So take the little rubber band off the tourniquet, and I'm going to unroll this tourniquet and kind of stretch it out a little bit. Now, when putting a tourniquet on a patient, you always want to utilize a knot that is quick release. Okay, so basically we're going to create a knot that looks like this. Okay, and this knot can then be just you pull one end and it easily opens. So I'm going to place this tourniquet around my patient's arm. Okay, put it right here. And I'm going to tie that tourniquet. So we cross the 2 ends over each other, and we give a little stretch, and then we just push one end underneath. And this is what your tourniquet looks like when it's on. When I want to take it off, I pull the tab and the tourniquet is off. We never, ever, ever want to tie a tourniquet in a knot. We have to be able to get it off quickly. All right, so I'm going to put this tourniquet on my patient. Okay, a little stretch. I'm going to put that tourniquet on, and I'm going to have a little look at that vein that I've chosen that I'm going to put the IV in. And it looks good, right? It's popped up. It looks good. So next step, very important. Be mindful of your tourniquets. Don't leave them on your patients for extended periods of time. I'm just going to release this, but I'm going to leave it in place because I am going to have to tie it again. So the next thing I want to do is I want to get the rest of my equipment ready. So I'm going to choose this type of angiocath. I want to put a 20 gauge in this patient. I'm going to peel open the packaging. I'm going to take out this angiocath, and let's have a little look at it. So when we pull this open, you're going to see that you have a needle there. That needle is covered by a plastic sheath. Okay, so if I were to loosen this and pull this off, you see that the needle is left, but the sheath is very bendable, right? It's plastic. This is the part that's going to stay in the patient, okay? Now, for demonstration purposes only, I am resheathing that needle. All right, I also noticed that there's sort of this sort of rectangular box around here. It has some ridges on it so that it's easy for me to hold and have control over. And I'm also going to look closely at the tip of the needle, and I am going to see that there is a bevel or a slant on that needle. When I'm inserting the needle into the patient, the bevel always has to be facing me. In other words, the slant has to be facing me. Okay, so let me just, again, for demonstration purposes only, I'm putting this cap back on. We never, ever, ever want to recap a needle, particularly a needle that we have used. Okay, so I'm going to put that down. Now, at the end of the catheter, if you remember from this one that we took out, right? So here is that pink catheter, right? This is referred to as the hub of the catheter. So this went into my patient, and then I had to connect this tubing, this short extension tubing, to it. So I want to prepare this tubing. One of the things that we need to do is we need to get the air out of the tubing, because we never want to infuse air into a patient. So I'm going to open this package and get out this small extension tubing. I'm going to notice it has two ends. Both ends have a cap on it. I'm also going to notice this thing sliding back and forth is actually a clamp, so that I can slide this across the tubing to close the tubing, slide it the other way to have the tubing open. I want to prime this with some normal saline. So again, I'm going to have a syringe with normal saline. I'm going to open this up. This is a 10 milliliter syringe with normal saline in it. I am going to remove the blue cap end and remove the white end off my syringe. Please keep in mind that, again, I mentioned to you that although this is not a sterile procedure, there are many components that have to remain sterile. When I take this blue cap off of the end, I cannot touch this end of my tubing in any way. When I take the white cap off of my saline, I cannot touch the end of this syringe in any way. I'm going to put these two pieces together, and I'm going to use this as a little receptacle for my saline. I'm going to push the plunger and get some saline. Hopefully you can see a couple of drips there. Get some saline. So now I know that this tubing is full of saline and no longer full of air. Now, what to do with this syringe? I want to take this syringe off, and when I take it off, I find that this is open, right? So I need some sort of a port to put on the end of that. So I have a port, okay? This is my port. I'm going to open up this packaging and take that port out, and the port has two ends. This end is the end where I could attach a syringe or IV tubing. The other end has a small cap on it, and this is the end that's going to get attached to the end of this tubing. So first I can take this cap off, and again, not touching any portion of that hub. And then I'm going to remove my tubing from my syringe, and I'm going to put the port and the end of the tubing together, twist to the right, and now I have a port on the end. So my tubing is now all prepared, okay? All right, so I've got my gauze, I've got my alcohol, I have my transparent dressing, I have my roll of tape, I have my angiocath, I have my angiocath, I have my saline syringe because I will have to flush after I have inserted the IV. And of course, I have my extension tubing with the port on it. So now it's time again for some hand hygiene. and telling the patient, now we're going to put in the IV. I'm going to don some non-sterile gloves, and now I am going to replace that tourniquet. All right, I'm going to put that tourniquet back on and let that vein sort of pop up. No hitting of the veins, right? No rubbing the veins. Just let them pop up naturally. So once I see my insertion site, I'm going to open up my alcohol pad, and I am going to clean this area where I'm going to stick with concentric circles round and round, coming further and further out. I never want to do something like this because I'm just dragging organisms from here to my potential invasive site. So we're going to put it down right where I'm going to stick, and I'm going to go in these concentric circles round and round, getting wider and wider. Now I am going to have to allow this area to air dry. We cannot fan it. We cannot blow on it. We have to just let it air dry. It doesn't take long. In the meantime, while it's drying, I can take the cap again off of my angiocath. Make sure that I have that bevel facing me. And what I'm going to do is you need to stabilize the vein. Okay, we want to stabilize the vein. So usually what we do, let me get rid of this box. Usually what we do is we use our thumb to pull down on the vein while we are then inserting the catheter. So I'm just going to put this on this little side table here, okay? Hopefully you can see that vein that's kind of bulging out right here. And this is where I'm going to do my stick. So I'm going to use my left thumb, because again I am right-handed. I'm going to use my left thumb to kind of pull down this vein, right, towards me to stabilize the vein. I'm going to have my bevel facing upward, and I am going to insert this needle at roughly, did I lose my needle? No, okay. I am going to insert this needle at roughly a 15 to 30 degree angle, okay? I don't want to insert it at any other angle because the veins are very small, and we could end up actually going through the vein, right? So I've got my thumb stabilizing that vein. I'm going to have bevel up, and I am going to, I think I lost my needle in here. No, it's right there. What's the problem? Oh, okay, there we go. All right. Now, what you just saw me do there on the video, of course, is something that you would never do, right? Can't touch the needle and then put it into a patient. I'm just, getting it for demonstration purposes. Okay, so again, my thumb is pulling down. I have my needle at 15 to 30 degrees. I'm going to insert my needle, okay? And immediately I should see some blood flashback in the plastic tube that surrounds the needle and a little bit into the hub. Now, with that being said, please don't get hung up on the flashback. If you don't see the flashback, it doesn't necessarily mean that you're not in the vein, okay? So once I see that flashback, or I have about a third of the needle inserted, the next step is to guide this pink part into the patient and pull back on the needle. So let me come a little bit closer. Okay, so I'm going to feed this catheter into the patient while I am extracting the needle. Okay, once I have the needle out, I want to engage the safety. Can you see this needle going up and down? I'm going to engage the safety until that needle disappears and you hear the click. Immediately, I am going to remove my tourniquet, And at this point, I could place the gauze with my finger, and just to put a little pressure there to stop it from bleeding, I'm going to take that extension tubing, right? The extension tubing, I'm going to take the cap off the other end, and I'm going to connect these two pieces. The hub, let me come here, the hub with the tubing. So there's my IV is in place now, okay? So I'm going to repeat this because I want to show you with the other type of angiocath. So this type of angiocath, a little bit different. Now what's different about this one? This one comes with its own extension tubing already attached to my IV. So I don't have to do that separate piece of tubing. But what I do need to do is I do need to flush this IV. So again, I'm going to take this cap out of the top, okay? I'm going to take my syringe with my saline, connect the two. I'm going to push a little bit of saline through there. So hopefully you see some drops coming out, right, of the saline, okay? So now I know that there's no air in here. But again, I have the same dilemma I had before. I need an end piece for this, right? So I have another one of those ports, right? And I'm going to take the cap off the port. I'm going to take the syringe off of here. I'm going to put these two together, okay? So now I have my angiocath and tubing is all ready to go. So again, I have already pre-selected my site. I am going to put this tourniquet back on my patient's arm and making sure, again, a little stretch and then put it through so that it's not knotted, but it looks like this at the end. I'm going to take my alcohol. I'm going to cleanse that area, concentric circles, round and round. While that's drying, I'm going to have my angiocath ready to go. So I'm going to take off the cap from this angiocath. The bevel, again, is going to be facing me. This one comes with these little wings on the side. Can you see them? They are for you to be able to hold this catheter. You just sort of bend them, and that's what you're holding this catheter with, those wings, right? You've bent them up. Okay, so again, I'm going to place my thumb, and I'm going to pull down on this vein to stabilize. I'm going to go at that 15 to 30 degree angle, about a third of the way in. I hope to see some blood flashback. Once I am in, I'm going to use my index finger to push on this little ridge that's here. I'm going to push the catheter off into the patient while in the back, the needle is coming out. There's my needle, and it's all protected, right? I'm going to immediately release my tourniquet, okay? And now I'm going to dress this. So what do I dress with? It's simply the transparent dressing, okay? I'm going to peel off the back. I am going to place this dressing right across here to cover the entire insertion site, my catheter, and part of my tubing. This white paper peels off. Let me just get that started. This white paper peels off, but don't discard it because it does have a label for you to use. So I'm going to pull off this paper, right, coming round and round. Get this paper off of there. And this is the part that I was talking about where there is this portion that has a little label for you to use. Okay, see that label? And that label says initials, date, and gauge. So that's information that needs to go on that label. But we're not quite done with this yet. Now we want to make sure that we are actually in the vein, right? So I'm going to get that syringe that I used before. I'm going to scrub my hub, right, because this was down on the patient's skin. I'm going to use an alcohol pad. I'm going to scrub this hub. I'm going to insert my syringe, push and twist to the right, and I am going to instill about 3 milliliters of saline. Okay, so I'm pushing in that saline, 3 milliliters, and it's flushing fine. There's no swelling at the site. The patient's not complaining of any pain, so I think this IV is good. I'm going to discard my syringe. I'm going to use this clamp here, this white clamp, to close off this tubing so that blood doesn't come backward. And then I'm going to remove my gloves, do some hand hygiene, get a pen. I'm going to put my initials, the date, and this was a 22 gauge. So I'm going to write that all on this little label. And this label is then going to go right on the side of the IV. So that's what it's going to look like. You never want to cover the insertion site with anything because people have to assess that insertion site, right? And we don't routinely change dressings on these IVs. Now, one last thing. The end of this port needs a port protector, also known as a Kuros cap. And I think I have a Kuros cap here. We'll place that on. So this is a Kuros cap. They come in different colors. This is a green one. And then I actually have this one here that's actually orange. So I peel off the foil on here. Inside there is a little alcohol pad. And this goes right on the end of my port. And this is a port protector. It's one-time use only. When you take it off, it goes in the garbage. We cannot reuse it. Let me just show you what the orange one looks like. So again, a little peel, okay? And there is my orange cap, and in the center, there's a little alcohol pad in there. This one is going to, again, push and twist to the right. And now we have an orange cap. Does it matter what color cap? No, you follow your hospital's policy and, of course, whatever type of equipment your hospital happens to have. Okay, and then last but not least, I do hand hygiene again, and I want to do some documentation, right? In my electronic health record, I need to document where I put this IV, what size catheter it was, whether I needed to attempt this placement one or more times. That type of information is going to be documented. So that's it for our peripheral IV insertion. Of course, you're going to get to practice this in lab as well. And I think that, utilizing all of this equipment will become much clearer to you when you can actually have it in your own hands. So thanks again for watching, and I'll see you soon.